And Janet, I'd love to start off with you on this one. What are some of those provider workforce challenges that healthcare leaders are facing today that make those traditional siloed staffing models that we've seen for so many years no longer sustainable?
Sure, absolutely. Great question. As we have worked through all of our, the physician shortages over the years, we're showing 86,000, depends upon what source you're looking at. You have to be creative in how you're caring for your communities and your care models. And so we all have to work together towards care coordination, whether it's, relying on a higher APP to physician ratio, bringing in those RNs, bringing in nursing access centers. There's so many different pieces, but we've all been challenged with the opportunity to figure out how do we do more with less, right? How do we look at productivity? How do we, what do we do, and bringing in our locum staff, we make sure we've got that solid need and, to make sure that we keep covering a service or keep covering, call coverage for different hospitals and medical groups. So, one of the things that we're really doing, and I'm seeing a lot of my colleagues across the country doing, is we're slowing down, but only to reevaluate the performances of, what's happening, how are our current physicians and APPs working? Are we letting everyone work to the top of their scope of practice? So we really, you really have to think differently now. It's a great opportunity for us to really challenge the norm and really come out with a new way of doing things going forward.
And I love that you mentioned the top of the license piece, because I think that's so crucial for healthcare today, is making sure, especially as we're looking at capacity, to be able to make sure everybody is where they need to be, just essential. Chris, similar for you, I'd imagine, but what are some of those challenges that you're looking at in terms of making those traditional siloed staffing models no longer sustainable?
Yeah, so I want to take a step back for a moment and kind of look at the macro of what's going on in the healthcare industry right now. I think it's important for us to remember that providers really operate within a healthcare ecosystem. And I think all of us who are in this industry are well acquainted with some of the challenges we're all facing. Some of those are physician shortages. At the same time, we have an aging and a sicker population. Supply is not meeting demand, as has already been said, and predictions are indicating that this is going to get worse. We have certain specialties, anesthesia, primary care, urology, GI, that are already today difficult to recruit specialties. Physician burnout is something that we're hearing more and more about. It's pretty prevalent. We also have seen shifting generational expectations of work of the newer physicians that are coming out of fellowship and residency program. What their expectations of what their work life will look like is vastly different than what we have seen historically. We're seeing a lot of demands for work-life balance being much more valued, again, than what we've seen previously. At the same time, we have financial pressures. Since 2020, we've seen inflationary pressures that are placing significant strain on healthcare organizations. And we're also seeing a lot of challenges around financial sustainability. I do think that all healthcare systems, if they're not already doing this, they're going to be forced, all of us, to start thinking and acting really with systemness. Rather than fragmentation. I also predict that we're going to see a lot of service line rationalization that occurs within the industry out of necessity for those systems that have not already deployed that model. So I think these trends really reflect something that's a broader industry ecosystem issues and challenges that we're all facing that are going to push the industry towards more strategic thinking and more planning and rethinking how we're doing things.
And Chris, thank you so much for taking a step back there, because I think that's very, very important to be able to look at how the environment has changed and then also how it's influencing today's environment, which is so crucial. Teague, from your perspective, I'm assuming these are conversations that you're having, right? These are these issues that we've just touched on. What does this look like for you?
Yeah. So echoing what my partners are talking about, healthcare leaders are dealing with a perfect storm right now. The physician shortage, rising burnout, the unpredictable patient demand, and the escalating labor cost. The premium labor, everyone's fearful word is that premium labor word. But in our world, when locums and permanent recruiting operate in silos, organizations become more reactive instead of strategic, right? So those models weren't built for this level of volatility. Today's environment is going to require a lot of coordination, a lot of flexibility, and informed planning to maintain what we're all focused on, which is access, quality, and financial sustainability.